Joining us now is Dr. Omar Latif, CEO of Chicago's Rush University Medical Center, and Troy Wells, CEO at Baptist Health in Arkansas. Gentlemen, thanks to you both for being here. Dr. Latif, let me begin with you. You know, sometimes we begin on vaccine distribution. Sometimes we begin on what's going on the ground. Let me do that in terms of the virus right now, what you're seeing in your community, in your hospital, hospitalizations. Give us an update.
Yeah, so initially we felt a second surge about a month and a half ago, where our volumes really approached the volumes that peaked during the summer months. Now we're starting to see that number decline, which I think is a response to bending the curve from some of the mitigation efforts put in by the state and the city. So on the front lines, we're starting to see our ICU. We have bed availability. We have our general medical wards. We have bed availability. While we have a huge number of people coming into the emergency rooms with flu-like symptoms, we are able to keep up, and Chicago's done an amazing job of staying under the curve of our healthcare resources. All
right, Mr. Wells, same question to you, and then we'll get to vaccine distribution. What are you seeing on the ground in Arkansas right now?
Well, during and right after the Christmas holiday, we actually saw a reduction in reported positive cases. Of course, we quickly realized that was due to people not coming in for tests and testing centers being closed over the holiday weekend, and that changed yesterday when we started reporting near record levels of positive cases in Arkansas. And as you know, hospitalizations don't care about holidays or testing stations being opened, and we saw a continued creep upwards in our hospitalizations from COVID-19 over the holiday weekend and into this week. And we've had 3 days in a row of new highs for COVID hospitalizations here in Arkansas.
Dr. Latif, I do want to get to the vaccine and vaccine rollout with you. One of the conversations we've been having for days now is the bottleneck that seems to be within the system right now in terms of getting those produced vaccines out and distributed and into people's arms on the ground. What are you seeing in terms of your sphere of influence? And can you speak to whether you are getting the supplies that you anticipated this far into the process?
Sure. I would say that, I think if you take a step back and acknowledge that this is the largest logistical healthcare challenge as a country as we've ever had in terms of getting the vaccine out. And then you really consider that health departments historically have been underfunded and not had massive resources. And we saw that initially with testing. It's not surprising that with any rollout this massive, you'd have some hiccups and some quirks. That said, the state of Illinois has worked, we think, incredibly closely with the city of Chicago, and we're an urban medical center in the city of Chicago, and we've been given vaccine for our first responders. And as soon as it comes out, there's a lot of communication that goes back and forth so that we can get it into the arms of people that are working on the front lines. And we've built a capacity to do around 1,000 a day, and we were able to get that vaccine 3 different weeks now to get it into our frontline workers. We would obviously love to have more, as with the rest of Chicago and the state of Illinois. However, given the numbers and the supply chain demand in the country, we are comfortable and actually optimistic about what's happened so far in our state.
Troy, I'll put the same question to you regarding Arkansas. What are you seeing right now on the ground?
Very similar situation. I think it's gone very well. We at our health system received over 7,000 doses initially of the vaccine. We've given over 6,700 staff members and physicians a vaccine as of yesterday, and we started to receive a second batch of vaccine this week that we can continue to use. I do think it's really important that we think about public-private partnerships as a means to vaccinate the public, to get the vaccine out quicker. One of the challenges we have today is just not knowing what's coming to us and how we'll be expected to participate in vaccination of the public. We certainly want to encourage that and do that because we recognize that the sooner we get the high-risk individuals vaccinated, that will start to relieve some of the pressure on hospitalizations.
Shepard Smith here. Thanks for watching CNBC on YouTube.